Coronavirus imeleta mambo mengi. Coronavirus imeleta matatizo. Coronavirus, also known as COVID-19. London lockdown. Her Majesty the Queen.
And I want to reassure you that if we remain united and resolute, then we will overcome it.
And now, let us hear from the Prime Minister.
I cannot stand here and tell you that we will have, by the end of June, that we will be on the downward slope. It's possible, but I simply can't say that that's for certain. Of course not. We don't know where we are.
Wagwan, Mr. Bach.
COVID-19 discussion, gathering the best speakers from the UK and Africa. Ignatius Mugabo from Rwanda, Kigali. Professor Chris Imafidon, London, UK. David Otto, London, UK. Taniwa Ashiru, Lagos, Nigeria. Dr. Bereket Tesgay, London, UK. Join the conversation.
Yes, so last week we had a test and we were talking about COVID and how Africa is handling the situation. Now, of course, I have prepared a few videos which we will go through, but the basis of the discussion today will be based on that video. I understand that now the African finance ministers are seeking $100 to $150 billion to combat the virus, but they want this money to come from Europe or America. So, guys, it is entirely up to you to digest, to analyze, discuss, and I'm sure you are going to discuss this without bias. And I'm telling viewers that the people I have on the panel, they are very experienced in their own fields. We're going to start. I will introduce the panel. We have got two other guests who are coming, but as technology is not allowing us to do so, we have got three guests for now. We have got Dr. Bereket, who is from PENHA. PENHA is an NGO which has been operating for over 30 years. And Dr. Bereket is actually more of an international development man. And then we have got David Otto from Global Risk International. Anything to do with the security, if you want to know what is going on in Africa in terms of terrorism and stuff like this is the man you go to. And then we have got Lady Tanua Ashru from Lagos. She knows her stuff. When she starts talking, you will soon find out. So, ladies and gentlemen, so without waiting, really, let me start with David Otto, the man who is got so much experience in terms of Africa, weather, current affair. Before then, let me repeat this video because I think it will give us an indication of what it is that we are actually talking about. Right, so this is the video. Listen to the video and decide.
In France and many other countries, the UN Secretary General said he feared there would be millions of deaths on the African continent. Are you also fearing that this could happen on the continent?
I think that this current pandemic is an awful pandemic. It is one that is affecting the entire world. In fact, no country, no continent will be spared. And I think the statement made by the UN Secretary General, it needs to be taken like a message, a very welcome message that is to be sent out to the entire international community to call on all countries to stand united in solidarity solidarity for those countries with little means, especially those countries in the African continent. It is very true that a number of measures have been taken by countries, by the African Union. For example, on the 22nd February, ministers from the African Union met, and they agreed upon a continental-wide strategy to deal with the current challenge. Up until now, there have only been very few cases, especially when we compare our figures to other continents. There are only roughly 10,000 cases, but the pandemic is spreading at a considerable pace. So we have to be prepared. And to do that, we have to learn from those countries that have fallen foul of this pandemic before us.
Of course, some measures have been taken for years. For example, here in France, elsewhere in Europe, lockdown, essentially. The president of Benin, Patrice Talon, said basically his country has got the means from rich countries to confine its population. Do you agree that a lockdown is not applicable in Africa?
I believe that the lockdown measures can't be applied in the same way in all countries. You have to take into account a number of differences, sociological, economic, even cultural differences. It is true that in Africa, in the African continent, there are a lot of poor people living in major cities, and therefore it would be very hard to apply a total lockdown in these situations. So countries need to adapt the measures to their own situations. They have to try and limit large gatherings to avoid the spread of the virus. But to do that, they also need to take into account their own realities. African finance ministers have met and they have already come out with a number of forecasts, especially in relation to how the debt will play out. For example, they already say that for outstanding debt for 2020, there is roughly $44 billion at stake. But this is something in addition to the fact that the African continent needs rapid support in terms of liquidity for us to be able to, first and foremost, deal with this crisis from a health point of view, and then to deal with, obviously and quite naturally, all of the humanitarian needs that we will have in the near future, because there are a lot of refugees, a lot of displaced persons throughout our continent. So states need considerable support, and they need that now.
What do you mean by a lot? Do you have a number?
Well, moreover, I would just like to say that there are a number of states that are already very fragile. I could quote, for example, the Central African Republic, the Democratic Republic of the Congo. These are countries that require urgent support, and they need concrete support. I would actually like to convey a message. I would like to say that there are countries out there that need the support, and any intervention that we require needs to be void of any form of bureaucratic red tape.
How much do you need? What's your estimate?
The early estimates from our finance ministers set the needs at roughly 100 to 150 billion. But that's in a first-off situation. Obviously, as we assess the fallout of this crisis, that figure may rise.
Very quickly, Mr. President, we don't have much time left, but there are areas where fighting is continuing, even intensifying, because the world is busy elsewhere. In the Sahel region, in Libya, are you concerned that some are benefiting from this crisis to fight even more?
Quite unfortunately, the issues that you're mentioning are long-standing issues. But we have never stopped trying to raise international awareness as to the gravity of the situation in Libya.
Okay, gentlemen. The video it is a rather long one, but I feel that you get the idea. The African finance ministers, they are looking for 100 billion to 150 billion. So what do you think? Is African nations really, are they really going to get this money, what they are looking for? David?
I think, first of all, it's important for us to paint, the actual gravity of this coronavirus COVID-19 strain. As you know, there are so many. I'm not actually a medical expert, but we've all become quite knowledgeable as to this disease, because of its impact. So yes, we're talking about the COVID-19 strain, and this is a completely new strain. Yesterday, we understand that we had now about 100,000 deaths, recorded death as a result of this, this virus, and about 1.7 million people have been tested positive. And now this is a very, conservative figure, because, I think more than, 5 times that number are actually infected. But because the testing is actually abysmal, it's very difficult to actually put a figure onto how many people are actually, affected by the virus. So I think,
are we talking, David? Just sorry to interrupt,
yes.
cut you. The figures you are quoting? Are
Yes.
these figures general figures, or are we talking about Africa?
No, these are World Health Organization global figures.
Okay.
Now, the African figures, we have the most affected countries in Africa are the northern African countries, so Algeria, Morocco, I think Egypt as well.
Okay.
And then in Central and West Africa, we have a huge number from Cameroon. We have other countries coming into place. So I think it's important for us to because without actually having understanding, it's very difficult for any African country to really get a grasp as to how to actually tackle all this virus. So Joseph, what I think listening from what African chairperson Musa
Faki.
Mr. Faki is trying to talk about is there is a problem for Africa, because this virus has demonstrated that we can only fight the virus with an existing robust health system. It's not the kind of virus where you can. I can hear myself, Mr. Joseph. Is it my side or you?
I am not so sure why that is.
Okay, no, that's fine. Yes, so it's important to note that this pandemic sounds more like the actual First World War. It's never ever been seen before in the history of the world, where every country, almost every country, is on a total lockdown. So how Africa is going to cope with this is going to be a very difficult one. But I think, as the African chairperson is saying, each and every African country has to be able to evaluate existing health system and understand the interrelationships between between the economy, between the social interactions, and see how they can devise a way of actually curbing the spread of this disease, because one side is not going to fit all. And we must take that into context when we're dealing with this pandemic. So these are my initial thoughts. Now, in terms of the security implications of it, I think the problem where Africa is going to be heading is not actually the impact of the direct impact of the coronavirus itself, but what happens when states are on lockdown and people can no longer feed, because most people are hand to mouth in Africa. They're very poor. What is going to happen is that we may see that we would have some kind of a corona,
okay.
Kind of revolution.
All right. So we will come back to that point. Now let us hear the Lady Taniwa Ashiru from Lagos. Tell us what is the situation in Nigeria, because as we know, Nigeria is one of those countries, is dense populated, and it lacks a lot of basic how do I say
It looks like
everyday life basic things like water and stuff. How are you coping with that?
Okay. Thank you so much, Joseph. Thanks for, having me be a part of this panel. And I must apologize ahead of time because my internet is extremely unstable. And I must say this is part of the problem and this is part of what we're dealing with right now in Nigeria. But I'll tell you this, earlier today, I left the house and I went to the grocery store briefly to get some, so just a few supplies. And on our way at an intersection, there were a group of boys, we call them area boys. Now, we stay in a part of Lagos that is, it should be fairly decent. It's Lekki, it's a residential area. So there's this group of boys, I think there are about 7 or 8 of them. And they were actually just begging. If you look at it in reality, they were begging. But when you have a dense number of people like that who are blocking off the road and, making all sorts of gestures at people who are driving, blocking them from moving, it could be a little bit of a frightening thing, especially if you're alone and if you're a female. And the truth is, I had compassion over them. I understood what it was. But, they weren't supposed to be doing that. The truth is people are hungry. They are hungry. You have people who, when we're looking at it, trying to analyze who they were. These are the sort of boys who, when people go out to restaurants, they tell them, hey, I'll help you park your car. And, they guide them while they're parking the car. They get a tip for that. These are people who get money daily and they eat from that money that they're getting day by day. And so when you have days where...
Okay. When the internet connects, I know there is a little bit of a freeze here. Let us go to Bereket. Bereket, you are an international...
No one's going anywhere now. It's 14 days too long, and we're already seeing people outside saying they're tired of this.
Okay, so now we will come back to Lady Taniwa later on. But let us hear from Bereket. Bereket, you have been coordinating events in Ethiopia, Sudan, and in fact, even helping people on the ground. But it looks like now with this COVID-19, it has actually brought even more stress to those regions. What do you think, how they are going about it? Or is the government, are those governments really doing enough to help the people, or even are they aware of what is happening?
Thank you, Joseph, for having me today. So, sorry, I have been following the COVID-19 and especially in the East Africa side. So it's really very difficult in general in terms of its impact on the level of livelihoods among the people. It's global pandemic. It's affecting almost every country across the globe. Particularly coming to Africa, the first case was seen first in Cairo. It was the middle of February. But from then, it has been almost 2 months now. So these countries have been taking different measures of tackling this pandemic. Some of them, they have been really looking about the lockdown, very strict, kind of draconian approach. Some of them have been really a bit relaxed way of dealing with the issue. But I can see the impact is really huge because the economy of these households mainly depend on the informal cash-based system, which they are really being affected a lot. So the East Africa is already have got like according to the FAO report, about there are 20 million people are really severely food insecure. So on top of that, the pandemic is now coming to East Africa. This besides the locust invasion going on in East Africa as well. So the overall level situation is really hugely affected. And these countries have been really taking several methods of dealing with the issue. But my concern, some of them have been really taken a bit slow, because they should really learn and take proactively deal with the issue, because Africa luckily was lately affected by this disease. Late from Asia, late from Europe, and maybe perhaps late from the US. So it was in an advantageous situation to learn from others and then also based upon that experience to really launch a very appropriate measure to deal with the issue. Just to point on the issue of fund, you mentioned it. The World Bank already said they are going to give Africa, it could be loan or financial support, I don't know, but $160 billion. Similarly, the African Development Bank, they are really promising about $10 billion. But is this really adequate to deal with this issue? It's really, from my side, when I assess it, it's highly underestimated assumption. It's not really adequate to have this money and deal with this issue. For instance, the UK is a big, has got big economy, but as you have seen, they are already allocated more than $300 billion as a kind of mitigation fund.
Okay. Sorry for the interruption. It is true that that money is not enough to combat the COVID-19 in Africa. But how much is the African countries actually putting on the table? Because, say, for example, they are asking for $150 billion, but the chairman of the AU, he doesn't say, we have got 50 billion to put on the table. So, and also, how will they manage it? So let me go to Ignatius. Ignatius, if you are there and if you are able to connect with us, are you there? I can see your face, but can you hear us and can we talk to you? Ignatius? Okay. Let me.
Can you hear me, JJ?
Yes, I can hear you now.
Okay, yeah.
Okay. Now, we are asking, before you went off air, I played a video of the chairman of the AAU. They're asking for 100 billion to 150 billion. And that's what, did you hear Barakat, what he was saying?
Yeah, I heard a bit of him, yeah.
Okay, good. Now, I am just asking, if Africa is asking for 100 billion or 150 billion, but they are not actually saying that we have got 50 billion in our basket, we need 300 billion, but we need 150 billion from you. I don't see, the asking is not really balanced. What do you think?
I didn't follow that part of the conversation.
Right.
And I think, obviously, we know African economies, they're all weak, and probably they're looking for help from somewhere. But I just want to say, to highlight the response or the handling of the situation by Rwanda, where I am right now. I think compared to what Rwanda has done and compared to other African countries, I think Rwanda acted very early on and tried to put measures before even we had a case of any COVID-19. I remember earlier in February, even a minister of health lost his job because of, I think, the president, in his own wisdom, realized that the preparations that were being done at that time were lacking. So a minister lost his job, and a new minister was appointed. And straight away in February, Rwanda started preparing to deal with this situation. We got the first imported case in Rwanda on 14th of March. I remember I came in from London. I left London on the 10th of March, and in London, it was still business as usual. But in Kigali, when I landed in Kigali in the morning of 11th of March, there were all preparations in place to deal with this situation. There were cameras measuring people's temperatures. There were medical officers checking on people and asking them different questions and taking their details. And a few days later, that's when we got our first case of COVID-19. So I think in terms of handling this situation and in terms of reacting to this situation, some countries realized very late that this is going to be a public health pandemic, a public health threat. But as for Rwanda, they started really putting measures in place very, very early. The hand washing and social distancing and sanitizing, it all started early in February and continued in March until on the 21st of March. That's when Rwanda imposed a total lockdown. People have stayed inside. We are now in the third week, and that has helped very much. There are no more imported cases because the air space was closed, the borders were closed, so we had no more imported cases, although we are still getting a few cases of community spread from the cases that the imported cases that we had got earlier. So
thank you, Mr. Ignatius. That's good. Now we know, we have got the picture of how Rwanda is actually dealing with it. But we can't find any other country which is actually doing exactly what Rwanda is doing. Now, you see, let me swing this question to David, and then we'll come to Lady Tanu, and then we will go to Bereket. David, you see, this is what is happening here. I can see many Africans are relaxed. It's because people are not dying. And why do you think that is? Just because Africa doesn't even, we haven't even hit 500 people of the total death yet. But okay, I'm not just saying we need to hit 10,000 so that to wake up. What will make the African countries wake up? What will make them prepare for eventualities? David?
I think it's very sad to look at the way that African countries run their business, and this is the normal approach which the African people themselves have become accustomed to, and that is to not to panic, because even when you panic, there is nothing much that you can do, to make a difference to the situation. So my thinking is that even if African countries begin to carry out the same measures that countries like Rwanda have done, you've got to first of all ask if they have the capabilities to do that. Rwanda is quite different, and we must take into consideration that the entire Africa is not the same. So a lot of countries don't even have the equipment. They don't even have the manpower to carry out certain measures. People are worried about what they are going to feed on the next hour, not the next day. So yes, you rightly said why they are not panicking. You see that they are not seeing a lot of death in Africa, but I don't know. But one thing which I know is that the way the virus spreads, it looks like every continent takes its turn. It started in China, and then that was Asia. Now it's in Europe. It came to Europe. It's gone to America. So perhaps we are still yet to see the same impact that we faced in other countries, being faced in Africa. So I think it's very important to note that and dispel any of the fake news that goes around saying Africans, are immune to the virus. So just what I think Africans must remember is that this is a virus that it has to be dealt with between you and your immune system. Once you are infected by the virus, it's not about how much ventilation you get, or how much medical assistance you get. I think it's between you and the immune system. Of course, all these medical assistance that people in Europe get, it helps to sustain somebody for some time and perhaps get them to recover. But I think what is important for Africa now I'm not going to lie to you, is that every African needs to start building their immune system because the governments don't have the capacity.
Okay, just to stop right there, because you have actually touched something that I'm going to ask Taniwa Ashiru. Look, it is like this. When the medical facilities situation in Africa is, I don't even know how to explain it. The man, Musa Faki, he was talking about the Central African Republic, yeah? Yes. The Central African Republic have got only 2 ventilators for 5 million people. So how, let's say, for example, let us address this issue in Nigeria, because Nigeria, people call it the giant of Africa. Everything really, we should be looking at how Nigeria is performing. Medical facilities in Nigeria.
Yeah.
Can you talk about this and how the authority?
Absolutely.
Yes. Please go ahead.
Yes.
Okay.
So the medical facilities here are just completely almost non-existent. And so what we have seen in the past is,
okay, we have got a little bit of
people who are supposed to what you find is, okay, can you hear me now?
We can.
Okay, so you find that these people who are supposed to fix it instead end up traveling, going abroad to use the medical facilities and the healthcare system in other developed countries that have taken the time out to fix theirs. So what this epidemic has done right now for us is that it has reminded, or it's sort of a wake-up call for our government that if you can't fix what's here, it would eventually come back to bite you, because they cannot travel out right now for any kind of medical care. Now, another thing we also saw, and we have to commend the Lagos State especially. We all know the population here in Lagos State is about 20 million people. We're a lot. I mean, Lagos has the 5th largest economy in Africa. So one of the things that we saw here in Lagos is that a lot of the wealthy people in the town came together and put money together, donated money towards fighting this epidemic. And I think that has been very instrumental in the state really tackling this situation. The second thing is the federal government also made like a stimulus plan for people who they said were earning 20,000 Naira. I think that would be under about $50 or so a year. So they put some, bread and rice and just a few food together that they handed out to them. Some people were given money, but there's been a lot of controversy around that because it's almost like there was a lot of money with no proper accountability. Who are the people who are giving the money? We really don't know. Another issue we're seeing now in Lagos is there's been an increase in armed robberies. Now, I mean, people are being harassed when they're going out of their houses because, again, you have people who were homeless.
Okay, when she comes back, let us go to Bereket. Bereket, you have actually, as I said, you've been in Ethiopia. And actually, Ethiopia is also like a model for modern democracy in Africa. Is like is doing a whole lot of things that would be actually would bring actually pride to Africa. But how come that is not actually performing the way it is performing? Anyway, but before going to Bereket, before you answer, we want to hear these stories. If Tanoa is saying that people came together, they donated a whole lot of bunch of money and stuff like, why are we not seeing these in the media? Yeah, any reason?
Well, the media and somewhat healthy. Yes, so most of us, sorry, I don't know if that question was for me, my internet went out.
Yeah,
but most of the reason why we're probably not seeing this, is that, the bad news is what sells, and most of us have actually stopped watching the news because of that, because we're tired of just seeing that people talking about the numbers of people who are dying and not even the number of people who are who are recovering. And so they tend not to do that. But in Nigeria, there was a lot of press about that. It went viral on social media. And, a lot of people were talking about most of the donors were actually banks. So CEOs of banks, which technically there was this joke that went around where people said, well, if my bank CEO has donated money, then I guess I've already donated the money as well.
Okay.
And before I went off, I wanted to talk about very quickly why Africans think they can't catch this disease. Remember, even Trump at one point had said something about the heat coming and possibly helping them tackle the disease. We're on the equator, is extremely hot. People think that may be part of it. Also, there's been a lot of chatter that these symptoms that, COVID-related symptoms had actually been seen in Nigeria from about September of last year. There was a nasty flu that went around. And when people are looking in retrospect, they're thinking that this actually came in much longer than that. Same thing in January. There was a huge spike in these related symptoms as well. So I think more than we realize, a lot of people have probably had disease, have recovered, have built some form of immunity. And, there's just the rest of the African thinking that they're immune to everything. So,
okay.
that may
we will come back to you. We will come back to you later. Barakat, what do you think? We have got academics here in Europe. We have got people, like yourself. You've got a PhD, and we have got so many land people. Why does Africa always not believe in their own people who have got education to advise them? You think that is a problem there, or maybe this question is just not valid?
Let me answer your first question about Ethiopia. Ethiopia is a really very interesting country in Africa because it has got a lot of distinct characters compared to other African countries. In relation to the COVID-19, I can mention three things. During the last 2 years, the Ethiopian government or the Ethiopian political landscape has been really in transition from the previous coalition party, and the expected election was supposed to be in August 2020. Now, because of the COVID-19, now it's postponed. So a national election is now postponed. Another one is just officially, the Ethiopian government decided to have a state of emergency. So unlike other African countries which are dealing with this kind of pandemic, so the Ethiopian government officially said this a kind of state emergency. Another one just is being tried now. They are trying to allow the mobile money banking system or market. So in this kind of situation now, having this kind of facility might help to transfer money from one individual to another person. So this kind of social capital can really help to help each other, the householders. Coming to your question about the academic people of Afrikaners, educated people, scientists, so they have been really across the globe, also in Africa. I can see the bottleneck is mainly because there is no conducive environment where they can really experiment vaccine within Africa to deal with this kind of pandemic or virus. At the same time, I'm not really sure how much our governments really value the contribution of these potential academics or policy advisors. So I can see from the difficulty from the lack of political willingness from the state leaders to allow them, to give them a chance to exercise their own knowledge and practice. At the same time, the lack of facilities and laboratory facilities across these African universities.
Okay, gentlemen, ladies and gentlemen, I'm going to play a 1-minute video. Now, this video, we cannot compare the West and Africa, but this is the video which actually shows, they have just put up this temporary hospital, which is going to be, it's a facility for 4,000 people, right? Here in London. So please, let me play this video and then we can actually continue. Coronavirus,
kuleta matatizo. Coronavirus, also known as COVID-19. London lockdown. Her Majesty the Queen.
And I want to reassure you that if we remain united and resolute, then we will overcome it.
And now, let us hear from the Prime Minister.
I cannot stand here and tell you that we will have, by the end of June, that we will be on the downward slope. It's possible, but I simply can't say that that's for certain. Of course not. We don't know where we are.
Wagwan, Mr. Bach.
So, as you can
AJ,
see,
are you back?
Yeah, I'm back. Now,
okay.
This hospital was put together in 7 days here in the UK. And many people criticized, well, why doesn't UK follow this and this and this? But I am playing this video, so whoever is watching and discussing with you, what lessons can Africa learn from this? Because this is 7 days. It's taken them 7 days to construct a hospital like this. Yet we, well, as I said, look, we as Africans, we see things differently. But I am just, you guys, I'm just asking you guys, do you think that this kind of situation will alert Africans to consider health as a very big issue? Ignatius.
Well, let me just comment on what. Let me just pick up on what David said earlier.
Yes.
And Berket about Africa being a bit relaxed in responding to this situation, and a bit of myth that has been going around that this virus cannot, affect Africans. I think, first of all, I just want to underline the fact that we are not out of the woods yet. It's just beginning. If you look at the situation, take the example of UK, for example. When I left on the 10th, there were only 11 people dead. Now we are talking in terms of thousands, almost, coming to almost 8,000 now, 9,000. So that's just in a period of 4 weeks. And as I highlighted earlier, in Rwanda, we had our first imported case on the 14th. In Africa, we still have a few hundreds here and there, but remember the rate of testing for COVID-19 for this virus is very, very limited in Africa. So we might be having cases that are actually still hidden somewhere. So we are not out of the woods yet. I think it's very, very important that some of these myths about the climate, about the African immunity, about, it's high time that some of these myths are really debunked and people understand that as it has happened everywhere, it can happen in Africa as well. So let me just come back to the question you just asked me about the level of preparations. I think African countries are prepared in different levels. My worry is if this disease, if this pandemic reaches in African villages where the level of infrastructure is very, very limited. At least in the cities, they can manage to handle it somehow. And they are trying their best at different levels, but they are trying their best. So as taking the example from the UK and building of the hospital, and I think we have our militaries. They are ready to step in as soon as this is necessary. And there is a couple of infrastructure like stadiums and arenas that can be used for this purpose. But I hope we don't come to that. I really hope we don't come to that.
But
I'm sure they are watching, and they are learning lessons from what has happened elsewhere.
Yeah. Now, you see, this is just the question. Yes, we have got militaries, we have got arenas and stuff, but do we have the thinking, just to think quick, to, how do you say, just to resolve these risks?
Well, yeah, Joseph, I think we are learning. You know, Africa came late on the stage as far as this issue is concerned. I think we are late. We are one of the late parts of the world to to get this situation, and we must have learned from how other people are handling it. So I can't say that we are not watching. I can't say that we are not learning. The resource base might be very low in different countries, but I'm sure there is a lot of marshalling of resources that has taken place, as our sister from Nigeria just highlighted. And the private sector is also stepping in, to try to mobilize some of these resources that are needed to deal with this situation. So I can assure you that, although I cannot speak for all the countries, but I can assure you that at least in my country, what I can see from my own observation, there is a lot of preparedness. And if I hope the situation doesn't come to that, but if it comes to that, then.
Mr. Joseph, can I just add?
Go ahead. Yes.
To what Ignatius is saying? I think it's very important for us to, for us to all agree that no country has shown any level of preparedness as far as this particular pandemic is concerned.
Except Rwanda.
Each and every country that we know of at the moment, of course, maybe except Rwanda, each and every country that we know has been badly hit. Of course, China has expressed its own level of impact, but it's also very difficult to verify their figures. So what I think is, each country has a relative amount of preparedness, but the problem with Africa is we are not prepared at all. We don't have any kind of respect for crisis management or pandemics. Unfortunately, Africa has had a lot of pandemics to have been able to learn from this. We've had malaria, which is still there today. We had the Ebola. So there is. It seems as if somehow Africa comes out and survives. In spite of the abysmal level of preparedness that it has. So what I'm thinking is, I'm not somebody. I don't believe in miracles, but what I think is that right now, the truth is that there's no known cure. There's no known vaccine for COVID-19. So what each and every country is doing is to sustain, the people that have been tested, in such a way that their immune systems can fight the virus. And I think my advice would be for African governments to also look at this very seriously. We have a lot of local medications, that I think Africa can benefit from. I mean, of course, there's the issue of dosage. There's the issue of some of the after effects of some of these medications that Africa has. So I think what Africans should be doing, and I'm doing the same as an African, is I'm looking at various alternative treatments that could fight this disease. As Tanwa said, a lot of people in Africa suffer from high level of fever, cold, and perhaps it's already been there. Nobody knows. Africa, they don't test. So the point I really want to make, Joseph, is that Africa must look at its own way. Looking at the resources, however limited that it has, but we can do something which is a lot more different from what the Western world they are doing. The reason why we are on lockdown is because they have no clue. So perhaps.
Yeah. I hear you. This is very good. So I am just going to ask a question. This would be the closing question, and everyone will have maybe 2 minutes, talk about whatever you want to talk about it. We as people of African origin. We are Africans, we live in the West. And so how can we combine our knowledge with those who are at home? Because I know there are many doctors out there. We have got scientists, we have got in every area, believe me, you will find us there. But how can we come together and formulate some way of discussion or even workshops in order to highlight these, to educate the public, not the public actually. The public does not have a problem. I think we need to educate politicians. And how we need to educate them, we need to start asking them to listen to people, because it is the people who elect them. They put them there to present them, to represent them. So, say for example, you three people here, what kind of ideas can we come up with and either formulate workshops and say, well, look, we want to go to the government, or we are approaching you, whichever government it is. It could be Cameroon, it could be Uganda, it could be anything. We say, well, look, we have got an idea. We want to come and run workshops here. We want to speak with the politicians. Do you think we have a chance? Barakat.
Just briefly, I can add some points on this, what have been said. So there is a problem of linking science and policy practice, which really doesn't bring the well-educated or academicians, policy advisors to really work on this kind of emergency situation along their governments. So I see there is a problem, especially now with the lack of flight transportation from one place to another place. There is kind of distance created now. So, but still this is possible. I can see the role of African Union, the role of IGAD, ECOWAS, and also the SADC regional organizations, where they can really jump in, play their own role in really mobilizing this kind of resource. So we are not only talking about the financial or logistical resource, where we need really to talk about the human resource as well. So just to briefly comment this, I can say on this point. And finally, I can let's comment, JJ, on this point, where in Africa, we have been really facing a number of human and non-human disasters. Like we have been El Nino, the recent locust issue, famine, and also food insecure situations. But there should be a mechanism where these governments can have their own emergency set up to really to tackle any kind of situation when it appears. It's not like now when something happens, you can really try to mobilize your own resource and try to fight against this kind of disaster. There should be an institutionalized way of working with that, a kind of standby manpower, standby resource to really challenge this kind of situations. So my suggestion just to governments to look at their own emergency mitigation approaches and be ready for this kind of pandemic, or we could have also a similar one in the future.
Fantastic. Lady Taniwa, the same question. What can we actually do to collect all these academics and scientists, doctors, so that we can actually advise governments? Possible?
Yes. Nigerians actually make up the most medical forces in a lot of different countries. I know from my experience in America, there is no hospital you enter where you won't meet or see Nigerian doctors. The same, I guess, as well in the UK. Now, here, even in Nigeria, there are a lot of doctors. There's so many, they're very equipped, very well equipped. They know what they're doing, experienced. And then all of a sudden, we saw in the headlines that the federal government had invited Chinese doctors to come and help and assist with COVID. As you can imagine, the National Medical Association was not having that. And then the narrative changed and said, well, they were here to treat the Chinese who were, working in the construction company. Now, here's what I would say. If you look at Lagos State and how they responded to the epidemic, they did fairly decently. Now, I've been a part of a training for emergency preparedness for members of the different Ministry of Interior agencies. And when I was watching the Lagos State governors, for example's press conferences and just some of their terminologies and some of the things that how they've been tackling this epidemic, they were using the same terminologies that we've learned from the Internet Command System that the US trains across the world. They were using the same terminologies. They had the daily press briefings. They had, and you showed us a video about the beds. Lagos State, in conjunction with one of the banks here, actually built a 100-bed ICU structure. It was a tent in a stadium. Within about a week or two, that was set up as well. So I think we've tried. The government has tried, and trust me, I'm not one person that ever really say they've done anything good. But going forward, what can they do? Now, you see that habit of running out of the country to treat themselves. There was a little, not rumor, but this thing that went viral that said, hey, how about we start letting any politician that catches the COVID-19 has to be treated in their hometown, in the hospital that is in their hometown. Now, how would that fare? And if they really had to think about that, I think they would sort of change how they're doing it. And the second thing is about diversifying the economy. As you can imagine, Nigeria has been so heavy on the oil economy, and this epidemic was happening simultaneously with the global oil prices decline. So it has really put a hammer on the economy. And if anything, I think we should come out of this, and not just we, I'm also talking about our government, come out of this and really genuinely think about diversifying. Chloroquine they're talking about, we have trees here across our nation that the bark of the tree is that quinine ingredient that is in chloroquine. So why are we not at the forefront of healthcare or pharmaceutical, as the case may be? So we have a lot of soul searching to do post the COVID-19 epidemic.
Ignatius.
Yeah, I think the conversation now has to shift. Not only the government, but the government should start talking to their own people, wherever they are. As our sister highlighted, there are so many African professionals around the world. So we need to start looking at building our own infrastructure. I mean, the time of outward looking for help, there have always been outbreaks in Africa, and then we look for outside help. And this crisis has taught us that there is time when that help from outside is not going to come or is not going to be available. So we need to look at building our own infrastructures. We need to start to open up a discussion with our professionals outside the country and inside the countries and on the continent and outside the continent to see how we can boost our health infrastructure and invest we're investing in our futures. I just take an example of Rwanda again. We have a company here, which is a branch of an American pharmaceutical company, and it was started by a Rwandan, who is an American Rwandan who's been working in the health sector, scientific sector for a long time in the US, and he partnered up with other people in Rwanda and have set up a pharmaceutical company here. And they have actually they have been looking at local medications that people have been using for over centuries and trying to turn them into modern medications and patent them. And recently they have been talking about one that can act on this disease. So I think we need to encourage that. Our diasporas, our scientific community, both internally and externally, wherever they are, they should realize that in the end, Africa is home, and help in the building, first of all, help in developing these ideas, and then in building the real infrastructure that can deal with a situation like this in the future,
Fantastic. I think it has been a very stimulating conversation. We must do it again. I probably the next time we have a conversation like this, we should have some doctors on the panel, because we really need some doctors and scientists. So that is again.
Elkett is a doctor.
Huh?
Bereket is a doctor.
Medical, he seems medical.
He's an academic doctor. We want medical doctors and scientists. So
Yeah.
all you guys, if you combine your energy and your knowledge, and I'm sure you've got connections out there, we really need to hear to these medical doctors and anyone else who would like to see that we move in a different way. As you have said, the conversation has to shift. For me, how I see it is that we live in fear because our governments, they have put so much fear into us. We can't speak up, even if when you know that you want really to highlight, you can see there is something wrong. So for example, an observation in Africa, it will turn into criticism. If you say, well, the hospital is not working, or this road it hasn't been looked after for 20 years, then you all of a sudden you become an opposition of a government. So I think.
AJ, can I just make a quick point here?
Okay. Yes.
If you don't mind. Look,
I don't mind.
I think even the way we look at security is going to change. You know, we have always looked at security in terms of boosting our militaries and our military infrastructure.
Yeah.
But this disease, this crisis has actually taught us that one unexpected thing can devastate the entire country, and our militaries and our military infrastructure and arsenals will not help us. That's what we have seen. So we need to look at security from a whole angle of public safety, public health.
Yeah,
and
well,
all the other aspects of security, not just
from Global Risk International. This is the man who can maybe just touch on this. Thanks very much, Mr. Ignatius, for highlighting that. I have been saying that.
Sorry, Joseph.
Yes.
Yeah, sorry. I think what Mr. Ignatius is saying is talking about the aspect of human security, because
yes,
the human security entitles or gives the country an opportunity to be able to predict certain disasters, man-made or natural disasters. But the last point I want to make in regards to that is that African countries after this, and European countries and the rest of the world, they would have to sit down, especially Africa, and think about the issue of organization, the issue of knowing your nationals, knowing how many people you have in a country, so that because that is the biggest problem that Africa is going to face. We have no database, and because of that, we can't even know who we are helping and who we are not helping. So I think the level of organization would have to change, because that is where the biggest threat for Africa remains. We don't even know what we have in our continent, let alone how to handle issues like this.
So, okay, ladies and gentlemen, we are going to come to a close now. In fact, we are closing. But what I'm asking you, I'm here just to facilitate the discussions and make it as informative and educative as possible. But the input, you guys, you can actually take charge of this. So, for example, you can come up with ideas of topics of interests and where we need to discuss, because I will, yes, once you come with an idea, then I will go and do my bit, my research, and collect all the facts and maybe short videos here and there to make this, because really I want to make this possible. I've been on this trail for a long time. It's now, okay, it's coming together, but I know with you guys there, I'm sure we will prevail. So thank you very much, and I'm gonna just play out one video. This is my hometown, Tottenham. Coronavirus, imeleta mambo mengi. Coronavirus, imeleta matatizo.
Coronavirus, also known as COVID-19. London, go down.
Her Majesty the Queen.
And I want to reassure you that if we remain united and resolute, then we will overcome it.
And now, let us hear from the Prime Minister.
I cannot stand here and tell you.
So you see, COVID is brought so much chaotic. You could see me yesterday. I went out with my mobile phone. I was actually in the queue going to Tesco. You can see me walking, going to Tesco. And just to finish on one point, Musa, the chairman of African Union, he said that Africa does not need lockdown because the conditions are not actually fit for it. Do you agree or not?
I don't know if you saw at some point, the power went out when I was here and I had my touchlight from my phone on. So honestly, the conditions have not been easy at all. People have been, and I'm speaking from Nigeria, people have been running their generators nonstop. And maybe in Rwanda, you guys have more electricity. Good job. We don't. And so we're running our diesel. Their petrol stations are closed, so you can't even buy diesel when you run out. There's no water. There's no light. It has been a nightmare. However, all of that, it doesn't even measure up to losing a life. So at the end of the day, I mean, people had to beg people to stay at home because the conditions at home are not, I mean, this is for us that even have homes. A lot of people don't even have homes. So it hasn't been easy, but it was necessary and it's what we've done. And I just pray that the government really can stick to it till the end and not bow to the pressures of people to say they should come out again. The numbers of cases are increasing. So they need to do what they need to do to make sure this is completely wiped out from our society.
Yes.
Well, yeah, I think the lockdown really works very well in this kind of situation, you know, because this corona is antisocial. People share it when they come together, and the only way just not to share it is to keep people apart for a period of time, so that you know, those who are already affected can be cleared from the community.
And when do you?
I think there was no other way around it. No matter the situation, I think no more situation is more critical than safeguarding a life. So this is the only way to deal with this situation. I don't know. I know it's going to have very huge economic impact and all that kind of stuff, but in the end, the catch-22 you do when, you know, people are just spreading the virus, and you know, that's the only way to deal with it, honestly.
Okay, David, you wanted to say something.
Well, what I'm saying is that, you know, this is a pandemic, which means each and every country is affected. When you lock down your country, you've got to think about at what point do you open up? Because there's no scientific proof that people cannot catch this virus again. Yes, there is no vaccine, there is no treatment. So the question that countries must ask is, when you lock up your country, you have to think about at what point do you open up, and who do you open up your country to? You know, do you open up your country to people that did not lock down? You know, so there is a problem coming ahead. You know, lockdown is just one of it. The next one is, at what point do you open up? You know, so that's my own concern here.
Good, Barakat. We are finishing with Barakat. I know we have got so many ideas. I'm failing to finish because it is so good.
I completely disagree with Musa. The lockdown is the most important approach now at the moment. Maybe governments can take different ways of dealing with it. We can see Sweden, Germany, South Korea, China, and the UK or Italy. So there may be different approaches, but lockdown is the most important thing. But while using this approach, it's very important to ensure the food supply is continuing and reaching to these households. So it's important, but there should be a mechanism to really sustain the food security of these people in Africa. Thank you.
Okay, thank you, ladies and gentlemen, and I must say goodbye until next time.
All right. Thank you, Joseph.
Bye.
Good night, everyone.
Bye. Thank you very much.
Bye.
Bye.
Coronavirus in the letter